Okay, Engage Recovery at Penn. A patient engagement solution that coaches patients through surgical preparation and surgical recovery. I'm John Regan, a nurse in the quality department at Pennsylvania Hospital. We found that colorectal readmission rates, when benchmarked against our national surgical quality improvement program peers, has significant opportunity for improvement. We see from the literature review that 13% to 20% of patients are readmitted to the hospital after a colorectal procedure. That's upwards of 1 in 5 patients. The clinical analysis of the causes of these readmissions within 30 days across the colorectal service line and the causes of the returns to the emergency department indicate that 72% of these readmissions could potentially be avoided using behaviors and enhanced recovery protocols. The simple behaviors promoted through ERAP can potentially decrease these ED visits and decrease these ED readmissions. If prevented, this would yield approximately $500,000 in savings across the colorectal service line, with a potential savings of $10 million if scaled across all surgical specialties. Payers are currently bearing most of the cost for these readmissions. However, with the expansion of quality and value-based payment models, the risk for the cost of these readmissions is shared between all of our payers and Penn Medicine. Engage Recovery at Penn was initially started to enhance patient engagement in their surgical preparation and recovery, but also as a response to these financial changes that are approaching in healthcare.
Hi, I'm Stephanie Diem. I'm also a nurse in quality, specifically surgical quality. And I read those patient stories that lead to the outcomes. So when my husband was told he needed open heart surgery, I knew his story had to have a good outcome. We went to the physician's office and he was given papers and tasks and information. And then he was told that the surgery carried a 2% mortality rate. Well, everything else didn't matter anymore and he was pretty well shut down. So I knew that I really had to help him through this very complex period. I gave him checklists, big paper checklists. I coached him through the preoperative and postoperative period. And when I wasn't with him, I sent him text message reminders. Things like, don't forget to go out for a walk today. Well, soon he was really making a lot of progress, and he would text me back before I got to him saying, guess what, I went for a walk today. And I'm happy to report that in less than 2 months, he was a member of the Penn Medicine Heart Walk team. So not every patient has a nurse at home. Not every patient has someone who can coach them through this. So we started thinking, how about a virtual coach? Doesn't every patient at Penn Medicine deserve a virtual coach? Can we scale this? My husband became the first Engage Recovery at Penn patient.
Hi, my name's Alan Barr. I'm a general surgeon at Pennsylvania Hospital. Just want to explain a little about the whole process, which is ERAS, Enhanced Recovery After Surgery, which is a process to standardize surgical care based on best practices. The goal is to increase quality at the same time as lowering costs. Reports from Great Britain, where ERAS started, and many institutions around the United States shows that ERAS does work. However, in talking to our enrolled ERAP patients, several of whom came from my practice, and more important, listening to their stories and listening to their suggestions, we learned that there were gaps in the process and gaps that Penn Medicine needed to address.
As Dr. Barr said, the foundation of the behaviors that are encouraged through our ERAP platform are rooted in enhanced recovery protocols. However, traditional enhanced recovery protocols end when the patient is discharged from the hospital. This creates a critical gap for our patients. Patients preoperatively and postoperatively, when they're discharged from the hospital, provided reams of paperwork. Paper that's not easily to understand, it's not easily to discern, and often the verbal and printed instructions are often completely lost on our patients. Consequently, patient compliance with these critical behaviors is often poor. Engage Recovery Penn takes care outside the 4 walls of the hospital and helps bridge this critical gap when patients transition to their home.
We began our pilot with just a simple clinical text messaging with important behaviors during that critical gap period for pre and post-op care. Patients reported that it was very helpful for things like forgetfulness. Our patient Mary said, oh, thank you for sending me that reminder about the spirometer. I forgot to get that out of the bag. They also said it really helped decrease their anxiety. Diane said that she was very reassuring to get the text messages. But as we spoke with the patients, we realized they really needed more. They wanted to know what to expect, and they wanted a checklist so they could organize their day. They wanted answers to their questions, and they wanted educational resources. They wanted feedback. They wanted to know how they were doing. And they also wanted to be able to connect quickly with the care team in case of an emergency. So we moved forward and went to the second portion of our pilot, and we leveraged the Way to Health platform, which is an interactive platform that Penn has to interact with patients at home. We automated all the texting and sent the patients daily what to expect lists, and we also sent them checklists, and they were able to give us feedback on these checklists. We created a website with educational resources for the patients, frequently asked questions, and a quick link to My Penn Medicine. This website, all these changes gave us very, very positive feedback. Our patient Claire reported that she was really having a dilemma with her drains, her post-op surgical drains, and when she used the video that we supplied her with as far as caring for these drains, it got her out of her dilemma. We also had a young man named Chris that said, when you sent me that text message about eating meals in the chair, I never really thought about that before, but I challenged myself, and I made myself sit up more. And on post-op day 16, Chris was walking 3 miles a day. 2/3 of our 18 patients that we've enrolled so far have reported that an ERAP component initiated a behavior that helped them stay on track.
We started with patients in the colorectal surgery because they're the leaders of enhanced recovery here at Penn Medicine. We initially enrolled inpatients at Pennsylvania Hospital, and now we've successfully enrolled colorectal patients at HUP and Penn Presbyterian Hospital. We've expanded the ERAP platform to include patients in general surgery and plastic surgery, and now we have interest from our orthopedic surgeons, our oncologic surgeons, and our bariatric group. We've also expanded the education portion of the website on the ERAP platform to include not only patients who are admitted for procedures, but also patients who go home after surgery. So we have promising results, but we must continue to learn, improve, and evaluate our solution. In the next 6 months, we want to increase the number of patients enrolled in the ERAP platform and engage more surgical specialties. Larger numbers and more diversity will help us understand the impact of ERAP and how to personalize the care within ERAP to maximize the benefit for each of our patients. We will conduct robust evaluation using patient interviews, patient-reported outcomes, and measure the quality indicators that we discussed, our readmission rates, our ED return rates, and our surgical complication rates. We believe over the next 6 months, we can change the behavior for 2/3 of our patients for the better and see a significant improvement in our surgical quality and improvement in our surgical outcomes. We have an ERAP platform that lets us listen to our patients and continuously improve. Let's seize that opportunity and build on this success.